Here's a case of routine LASIK surgery. So modern LASIK starts with the femtosecond laser creating a flap. This is done by first docking the eye. In this case, the VisuMax has a nice rounded interface, which makes it more comfortable for the patients because we have to use less suction. Then the laser starts creating the flap. Flap diameters vary. In this case, it's 8.1 millimeters. The femtosecond laser works from the periphery to the center. Patients are instructed to first look at the fixation light, and then told that it will disappear. Now watch in the periphery for the creation of the flap and that superior hinge at the bottom of the screen. Next, we move over to the excimer laser, in this case the EX500. We first use the instrument to dissect the flap near the hinge and then free the entirety of the rest of it. Then we can retract the flap. I prefer this taco configuration where the flap is overlaying itself. This helps protect it and so it's not banging against the speculum. Next, the lights are dimmed. And in this case, which is a Contoura case, the iris tracking is engaged and then the pupil tracking is also engaged. So now it's tracking the iris to account for cyclotorsion and also tracking the pupil so the patient can make very small movements. We're always watching the eye for any large movements, in which case we would disengage the laser to prevent a decentered ablation. In the Contoura cases, you might be able to tell there the spots are a lot more random because it's also correcting those other aberrations. Next, we take the irrigating cannula and lay a bead on the stromal bed and then reach into the taco and then lay it across the rest of the bed. We do a quick squeegee maneuver, and then the last thing I like to do to a flap is just float it one more time underneath. Then we can take a slightly wet Wexel and check the gutters. In this case, when you get that ring all the way around, you know your flap is nice and centered. I don't routinely mark the flaps as some do. Then we add a antibiotic and steroid drop, and then that is really all there is to it, under 2 minutes per eye.